Okay, this video is meant to be a helper video for people that have an ostomy, like an ileostomy or a colonostomy, that need help caring for it. I noticed on YouTube there's only surgical videos and some other miscellaneous stuff that doesn't directly apply to caring for your ostomy, so I thought this might be a little helpful for people, because a lot of people are very embarrassed by it. Let's see, okay, let's run through some quick supplies. We have your bag. I use the long bags are a lot more helpful because you don't have to empty them every 35 minutes. There's stoma powder. Stoma powder is for if you have not a raw wound, but if it's kind of, the skin is starting to get very irritated and it's moist. This will dry out that and keep a yeast infection or any type of infection from forming. It'll help with it anyhow. You have your wafer, and as you can see, I took my medical scissors and I cut the circle to the size of, what your ostomy will be. Mine, I actually have a fairly bad, not a bad prolapse, but it's about an 8-inch long prolapse, which isn't, a great thing to have, but it happens quite often in emergency situation surgeries. The Adapt paste I have, I'm not sure what the brand names. Minnie, no. No. Stay over there. I'm working. This Adapt paste is good for, you put it just on the inner diameter around the cut of the wafer, and it'll create a nice waterproof situation. No. Off. Get off. Get off, chump. And let's keep going. Alright, this is your wound cleanse spray. I'm actually just about out of it. It's not, absolutely necessary, but it's very, very helpful for, you spray your gauze and you wipe down all the nasty stuff and the blood and the dookies. And anyhow, so I'm almost out of that. But you don't necessarily need it. You can use warm water as long as, you keep yourself semi-sterile. You'll be okay. So some little 4x4 gauze stacks, and I have some paper towels just in case stuff gets out of hand.